Alright guys, in this video we're going to learn how to suction nasopharyngeal. So naso is through the nose, pharyngeal is down through the throat, right? So we're going to suction through the nose down into the throat, okay? What we want to do is bring the patient up to where a good working height for us, yes? That's part of our WIPSA. Yes, it is. And then what we want is what we call a nasal trumpet. You're going to hear it known as a trumpet. Looks just like this. And this is what we're going to use. We're going to put this end into the nasal passage. And in order to do that, we want to put some lubricant. So you're just going to get a package of lubricant, and you're going to hopefully open it. And you're going to put it on some sort of plastic or paper towel. I generally just use a paper towel because then I can just throw it out. I'm not going to put lubricant on because it's going to be a pain in the butt to clean our mannequin, but what you would do is just lube this whole end, you know, really well, so that it slides into the nasal passage better. I also like to have my patients breathe out of a nostril, have them breathe, and then have them breathe, and I assess which one sounds more open, because that's where you want to actually instill this, is in the passage that's more open. So I've assessed that this nostril is more open for our patient. So literally I'm just going to instill it into the nose, into the nasal passage, until it's all the way down in there. And that's what it's going to look like. That is where we're going to put our suctioning. Okay? And when we suction, we need to have a kit. And in the kit is a container like this. And this is where we're going to instill some sterile water. It'll go into here, and what that does, it allows us to clean our suctioning device, because it's going to get grody with mucus. Okay, this comes with gloves in it. These are not sterile gloves. This is not a sterile procedure, okay? I have gloves on because I believe that that was a latex and I have to have it on. Plus, you'd want gloves on when you're doing it anyway, okay? So, this is what our suction catheter is going to look like, okay? Just like this. And if you look at the end here, there's some holes at the end of the suctioning catheter. Okay, and that's where the fluid, the mucus, is going to come into this tube. Okay, this is what we call the thumb hole, and what we're going to do is we're actually literally going to occlude the air so that it sucks the mucus right out of the person. This end right here, we connect to the tubing on the wall and in the suction container. So we just put this into the tubing. Okay, so it looks like that. And then when we do this, we're going to put our thumb over it and we're going to withdraw. Now, you can lubricate this if you needed to with our lube, okay? But you don't have to, because you have the nasal trumpet in there. You want to make sure that you have this up, your suctioning up to full, because we want to suction it right out of there, okay? And what you do is you don't have your thumb over the hole while you're inserting. So we're just going to insert down until we hit resistance. At that point, you put your thumb over and pull out slowly. And if there was boogers and stuff in there, mucus, guys, it would come up into the tubing and up into our canister. And then to clean this, you're literally just going to place it in here, clean the outside, and if you hold your thumb, it'll flush the tubing with water. And that's what you're going to hear when you're pulling out the mucus from the body too, is you're going to hear that sound, okay? You're going to do this again. You're going to continue doing this until you don't get any more, or you know, you just think that that patient's had enough. Now remember, when we're doing this, that we're also taking oxygen away from the patient. So do we want to do this like 10, 15, 20 times in a row? No, because, you know, we want our patient to be breathing. Breathing is always good, right? Okay, so we want to make sure that we give them a chance to breathe in between. Definitely stop if you start getting blood, because blood means trauma, and we've caused some trauma in there. Are you going to get blood? Yeah, you probably are. Yes, it is traumatic. Think about it. You put this down your nose, and you see how much trauma that is. It's traumatic, okay, guys? So, so that's how you suction nasopharyngeal. Now, let's say that we had a doctor's order that we needed to have a sample. We need a sputum sample. So what we want is what we call a mucus specimen trap, okay? It looks just like this. What you do is you open this up, okay? And you see it's already in a specimen container, like this is what we could send to the lab, right? And it comes with its own cap when we're done. And you could send this off as a specimen to the lab. But right now we need to get the specimen in it. So it is on here, okay? And then this we would have a connection so that this would connect better than what I've got right now, okay? There would be a white connector on here. I'm going to jerry-rig it right now. So this tubing from the wall would go into this opaque tubing here, okay? And then this tubing from the patient would actually go on here. And it's not going to. Oh vey. Oy vey. Not going to at all. But you would connect it like this, guys, okay? It would be connected like this. And what you do is the same thing that you would do for nasopharyngeal suctioning. You would put this down inside the patient, okay, until you hit resistance. You'd put your thumb over the thumb hole. You would withdraw, and it's suctioning, and as it's suctioning, it's sucking that stuff right down into here, okay? So then it would trap our mucus into this container here. And then we would just send that off to the lab. And that's how you get a sputum specimen for nasopharyngeal suctioning.